Hey everybody, welcome to my podcast with Higher Levels of Shay. Y'all come on and tune on in. It is Monday, happy Labor Day. And as discussed, you guys, we are going to be discussing lab values. Now, a few days ago, we discussed, what did we discuss a few days ago? Oh, we discussed just being a patient advocate and just knowing what to say when you go into the physician's office and you want to be a patient advocate. But today, we are going to be touching lab values, how to interpret labs, normal lab levels, and what it means if the lab levels are out of range. What each level mean if it's low, what each level mean when it's high. And the reason why we're doing this lab today is because it is your responsibility to be a patient advocate for yourself when you go to the physicians or any kind of primary healthcare professional, right? So I feel like this is a great follow-up, as it was suggested by some great people who was on my last live. And the reason why I think it's a great follow-up is because how do you know how to be a great patient advocate for yourself if you don't even know what's the normal versus the abnormal, okay? So we're going to talk about what's normal first. We're going to talk about what that means, and then we're going to talk about what's abnormal and what that interprets, okay? So today we're just doing simple lab values, and then next time we're going to do diagnostic studies like EKGs, MRIs, CT scans, and exactly what those labs mean, okay? So we'll go into the more critical, or even we'll do like cancer lab values, like rheumatoid issues. We'll do like those labs, HIV. So we'll do the more critical diagnosis on another day. But let's start with the basics first. Basics meaning your normal CMP, which is your complete metabolic panel, BMP, basic metabolic panel, CBC, and that is your complete blood count, all right? So we're going to talk about those things and more. I'll tell you this. If you missed today's show, Higher Level Shay Morning Radio Show on KPTV and KP Radio, you missed a good show. We had Dr. Deborah Anderson there, you guys. Dr. Deborah Anderson was in the studio, and we did a great interview with her. But you can find that replay on my YouTube channel at Higher Levels with Shay. She dropped some great gems, and on top of that, I also dropped gems on you guys on how to, if you're looking into be a real estate agent or own real estate, I gave 5 websites that you can log into to help you, build your, to help you be able to seize property that the government has seized and be able to own land and own real estate property at such a cheap rate. I also dropped gems on how to build your legacy for your family when it comes to trust funds and your life insurance policy, and how to borrow from your trust for your life insurance policy. So, man, if you missed today's radio show, Higher Levels Shay Morning Show, you missed a good one. Now, before we get into this live, I do want y'all to know that you guys have all the opportunity to be able to comment. If you want to request to come up, kind of give a testimony, share your story, or just simply ask me a question, you are more than welcome to do so, okay? Another thing I want to address on this live is, on the last live, we did a Q&A session, and there was an anonymous person that DM'd me, and they asked me about an STD. They said that their husband, she went and got tested, and she tested positive for gonorrhea, and her husband wouldn't go get tested. Now, since her positive diagnosis, obviously she was being treated, and she kept pushing him to get tested. And we do have a follow-up. So by the time we did that live on Friday, I actually ended up DMing me back. So if you on this live, I do have a follow-up for that. And she told me that he actually went and got tested. And so we are going to follow up with that particular question that she DM'd me about, and we'll go from there, okay? So I'm happy to have y'all here, and let's get into the labs. So for the first thing we're gonna talk about is, let's talk about iron, calcium, magnesium, potassium, sodium. Those are your electrolytes, okay? And you also have like your phosphate and phosphorus and everything. But let's talk about the main electrolytes: magnesium, potassium, sodium, iron, calcium. Now, this right here, those electrolytes, they are the very vital and essential minerals and minerals in your body that you need for your entire system to be able to run and function properly. If your sodium and your potassium levels are abnormal, then that can indicate a cardiac issue or a kidney issue. If your magnesium and your calcium is out of normal, then guess what that can indicate? That can indicate muscle issues and bone issues. I mean, this thing's gonna get deep. So I do want y'all to interact. If y'all are ready, tap the screen. Let me see some hearts if y'all are ready for us to jump into it. Go ahead and tap the screen, heart the screen. Let me know you all are there, because I'm seeing people coming in, I'm seeing people coming out, I'm seeing a lot of people coming in. So let me know you all are there. Tap the screen if you are there and you are ready to jump into these lab values. And thank y'all for tuning in to Higher Levels with Shay. I appreciate y'all being here with me. Happy Labor Day. And I know a lot of y'all probably at home barbecuing, so it won't be long. I know I say that all the time, then we on here for like 2 hours. No, today, seriously, it won't be long, okay? It will not be long. All right. Tap the screen. Let me know you're there. And then we're going to jump into it. All right. Okay, you guys are there. You guys are there. You're tapping the screen. And don't forget to tap the screen. It helps with the algorithm, okay? So if you are learning anything and you're enjoying this lab, then absolutely, I want you to tap the screen and get our algorithm up. So it's just to encourage others. Also, please share this live with others if you could, so they can learn something from this information as well. So I appreciate the likes and I appreciate the shares. All right, so let's get into your iron level, right? Because the question that I got quite a few times in my DM was about anemia, okay? So I want to talk about your iron level, all right? So the normal iron level is between 60 and 170, okay? So when you go get your blood work tested, you look at your iron level, it should be between 60 and 170, all right? Now, if your iron level is elevated, then that can indicate that you have a liver issue, okay? Because your liver is supposed to be able to break down the iron, okay, and disperse it into your bloodstream. So if your iron levels are elevated, meaning if your iron level is above 170, that indicates that you have a liver issue, all right? Liver issue. We're gonna get into other liver panels and other liver tests and lab work and blood work that you are going to follow up with. So let's say you go get your iron checked and your lab values, your iron level is 283. Already right then and there, you should be concerned about a liver issue, and then you should follow up and say, hey, can I have a liver panel? My iron level is completely off, okay? And then talk to your physician about that and see what's the necessary step. This is how you can be a patient advocate for yourself, okay? If your iron level is lower than 60, that can indicate anemia, all right? That's an iron deficiency. That means you're not consuming enough iron. You're excreting either too much iron or you're not putting enough iron into your body. And so you're gonna follow up with, okay, my iron level was low. What is my hemoglobin? What is my red blood cell count? What is my hematocrit count? So then you want to do what is called a CBC, your complete blood count lab. This is how you be a patient advocate for yourself, okay? So I want y'all to be following along with me, all right? The next lab I want to talk about is your calcium level. Why is calcium so important? Let's go back to why is iron so important in your body. Iron helps to bind the oxygen to your blood cells. That's first and foremost. So if you notice, if you start to have like, you have anemia, you're always typically cold. You always having a shortness of breath. More than likely you need a blood transfusion, you see, or an iron transfusion, all right? And that means that you don't have enough iron to your body, so that obviously without enough iron to your body, there isn't a lot of oxygen to your body, so you're going to be short of breath all the time, and you're going to be cold all the time, okay? So if you're starting to have those symptoms, go get your blood work done, and then you make sure you follow up if that lab value is out of range, whether it's low or whether it's high. And if it's high, remember, you want to check your liver panel, all right? Liver panel. Now, the next thing I'm going to talk about is calcium. Calcium and phosphorus go hand in hand. I'll tell you that now. And calcium is extremely essential for not only just your heart, but your bone, your skeletal function as well. We're talking about strengthening the bones, strengthening the skeletal system as a whole, as well as the muscular system. So when we talk about calcium, we're talking musculoskeletal system. Don't worry, because we are also going to go over foods that are rich with these specific minerals and vitamins, okay? So don't worry, we're going to cover that later on in the live, all right? Don't forget to comment below if you have any questions. I don't want to be going too fast for you all. So if you had a question about anemia or the iron levels, please feel free to comment and interact. Otherwise, I'm going to continue to move on. So when we're talking about calcium, and again, that has something to do with your muscular and your skeletal system as a whole, and your typical calcium level is between 8.5 and 10.5. all right, so that's 8.5 and 10.5. If you are hypercalcemic, okay, that means elevated calcium levels. That could indicate a slew of things. First and foremost, that could indicate a thyroid issue, such as hyperthyroidism, and your thyroid system help to excrete the calcium. So you having thyroid issue, and your calcium level is elevated, then you may have a symptom called hyperthyroidism, okay? And you could also have cancer. That could be a sign of cancer. This is not to scare you, it is to educate you. So if you go and get your calcium level checked and your calcium level is slightly greater than 10.5, then don't be alarmed. Still do follow-up testing. But if it's like 20, 40, then you absolutely want to make sure that you be a patient advocate for yourself. And you want to make sure that you ask the physicians to do some follow-up, like thyroid testing. Can you do an endocrine lab work? Can you do test me for, and be mindful about your symptoms. Make sure you tell them about your symptoms. If you're starting to have like facial twitching, you want to be very, very mindful about what it is that you're experiencing, and let's make sure that you inform your physician. Any questions so far? Any questions? Y'all follow me so far? All right, good. So if your calcium level is low, so if it's lower than 8.5, what does that indicate? That can indicate a metabolic issue. That can indicate an absorbent issue. Then it means that your body, your bones is having an issue with absorbing the calcium which you are intaking. Now again, you can also have a low calcium level from you not consuming a lot of calcium. And again, we're going to talk about calcium rich foods, all right? So thank you so much for the shares. I really appreciate it. Thank y'all for the likes. Thank y'all for the hearts. I really appreciate it as you guys are interacting. Don't forget to jump in and ask questions as we're going along on this live. So that's calcium, okay? So again, let's recap calcium. If your calcium level is elevated, then that's concerned about a thyroid issue. If it's low, then it's about an absorbent issue. You want to look at your bones. You want to look at the reasons why you're not absorbing the calcium and taking it in, okay? Another lab that we're going to talk about is magnesium. Now again, I was just talking about magnesium and how it's good for your musculoskeletal system, okay? And you don't want to have like muscle spasms, muscle cramps. You don't want to have you start having the mouth twitch, the eye twitch. That can be a huge concern when it's talking about your magnesium level being too low or too high. Too much magnesium, because you can start having diarrhea, okay? So too much magnesium will cause you to have diarrhea. I don't know about anybody who's ever been constipated or impacted. What do they give you? Magnesium citrate. And to help you relieve that GI issue. So too much magnesium could cause diarrhea issues, okay? So you want to make sure your body is well balanced. And so normal magnesium level is between 1.5 and 2.5, all right? 1.5 and 2.5. Queen Yana, you are absolutely correct. So I thank you for your commentary. So if you have an elevated magnesium level, again, this is a thyroid issue. Look at your thyroid glands, because what this can indicate is Addison's disease. And I want y'all to do y'all research on Addison's disease. And this is why it's important for you to make sure that you're a patient advocate, okay? This could also be an indication of a renal disease. Renal failure, renal meaning not kidneys. We already talked about this. So I'm going to use medical terminology with you in this process, but then I'm going to break it down to you in layman's terms what it means. So, too much magnesium can lead to a renal, aka kidney issue. All right. It can also be an indication of a very critical issue called DKA. That is diabetic ketoacidosis. All right. So, if your magnesium level is too high, you want to follow up with your endocrine testing, thyroid testing, okay? Diabetic testing. Let me check my kidneys. You know, your kidney function is going to be your BUN and your creatinine, all right? And we're going to go into those labs a little bit further as well. Again, we're going to talk about foods. We're going to talk about foods that are rich in magnesium, all right? Low magnesium, surprisingly, could also still lead to diarrhea, okay? And low magnesium is usually a lot of issues that you commonly see somebody with low magnesium is alcoholism. Consuming too much alcohol. Lorraine, thank you so much for liking the live. I appreciate y'all for sharing the live. And I encourage you all to please do so as we're going along. And do comment, okay? Because I want y'all to be interacting with me as well. If you have any comments on what I'm saying, okay? Yes, Queen Yana. She's on it. She said metabolic acidosis. You're absolutely correct. So, low magnesium can also be your pancreas issue. You can have inflammation with your pancreas. That medical terminology is called pancreatitis. All right. She said slow down a little bit. All right. So did you get everything that I said, or what part did you not get? Because I would love to go over this. And so when you talk about magnesium, it can be a pancreas issue, and it could be a liver issue. And again, you want to check your liver panel. You want to check your pancreas panel. Lab results. Okay. So that's what I want you guys to take from this, and how to be a patient advocate when we're talking about reading these labs. All right. I know y'all have to get to y'all barbecue. I know it's Labor Day. But I thank y'all for tuning in and just being for me as we're going through these lab values and how you can be a patient advocate for yourself. And share this information with other people. And again, as we're going through this information, and if you're just now tuning in, I will have it posted on my YouTube channel at Higher Levels with Shay. This lab I actually will be able to post, all right? And you can also find my morning radio show, Higher Levels with Shay morning show, on my YouTube channel as well. That show was an amazing show this morning on the radio, and I hope that you guys tune in and enjoy that show as well. So, since we're talking about liver issues and other enzymes, so let's talk about some enzymes. We got the amylase and we have the lipase, okay? So, we have the amylase, the lipase, and the ammonia levels. So let's get into it. So your normal amylase level should be between 23 and 85. All right, 23 and 85. And if I'm going too fast, please let me know. Now, if your levels are elevated, then again, that indicates a pancreas issue. All right, that indicates a pancreas issue. So you want to check your liver and you want to check your pancreas. Okay, if you have any, if it's too elevated. Okay. Then you have your lipase level, and your lipase level is between 0 and 160. 0 and 160. All right? And these are your liver enzymes we're talking about here. We're talking about liver enzymes, all right? If it is elevated, again, you should want to, I want you to be a patient advocate for yourself and understand what that means. And if your lipase, if your amylase, if your ammonia level are extremely elevated, then you need to check your liver. Check your liver. It's not really often that you will see it, I don't want to say you will never see it low, but it's more common for your levels to be elevated to indicate cirrhosis, pancreatitis, hepatitis. And hepatitis is inflammation of a liver, and we all know we can contract hepatitis. They have hepatitis A, hepatitis B, and hepatitis C. All right. So that's when you will start to see those abnormal lab values. Do I have any questions right before I move on? Any questions? And I want you guys to keep in mind that when we're talking about lipase, if it is elevated, that can also be an indication of congestive heart failure. congestive heart failure. So you want to make sure you're checking your cholesterol level. Make sure you're doing your EKGs, and we'll do EKGs on another show. But you want to make sure you're doing your diagnostic studies to make sure you're actually taking a look inside your heart. You want to do a CT scan. All right? So this is how you be a patient advocate for yourself when you are sitting in a physician's office, or if you're on your MyChart. And we already talked about that electronic chart that you can log into right there on your phone, readily available, okay? Thank you so much. I appreciate it. And so we already discussed that. So if you look at your MyChart and they say your lab values are normal, a lot of people, what they tend to do is they'll see the lab values, and if it doesn't have a CL critically low, or if it don't have a CH critically high next to it, or don't have an abnormal red symbol to it, they automatically say, okay, I'm good. But they have a hard time truly interpreting, what does it mean? What do these lab values mean? You know? And that's the reason why we're going over this lab today. So if I'm sitting here telling you to be a patient advocate for yourself, then I have to give you the basics. I have to tell you what's considered normal and what's considered abnormal, what to look for, and if it is abnormal, what's the next necessary step that you should be taking? What's the next question you should be asking? If your labs are abnormal, that indicates a liver issue or a kidney issue, then your doctor should automatically want to do further testing on you. They should be asking you questions they should be doing a further deeper assessment on your liver and on your kidneys. You see what I'm saying? And palpating to see if it's extended, to see if they can feel that it's enlarged. You see what I mean? Whether it's your kidneys, whether it's your liver. They should be doing other necessary steps to make sure that you are okay. They should be running your BUN, your creatinine level. They should be running your liver panel to make sure that you're absolutely okay. All right? These are things that they should be doing. So if they don't do it, then at least you can know exactly what it is that you could do as a patriot of their establishment. All right? Thank you all for joining my live. I'll be posting this live to my YouTube channel. Now we're going to get into hemoglobin. So your normal, not hemoglobin, A1C, because he has found on the last slide to talk about the A1C. Your A1C level should be less than, they say 5.6, but I say 5.5 because statistics are starting to show that if it's below 5.5, then you have a better chance at catching. And A1C level is for diabetes. Let me just make sure I go back a little bit because I think I'm jumping ahead of myself. Your A1C level is to check the last 3 months of your glucose level in your blood to determine whether or not you are diabetic or not. That's what the hemoglobin A1C check is for, okay? And you want to make sure that lab is less than 5.5. So I think that the person's lab on the last lab was 5.5, and so they're like pre-diabetic. And they said 5.6 in the past, but in recent studies it has been shown that doctors are now, being proactive if you are 5.5, because it's easier to maintain, it's easier to prevent it from becoming diabetic, okay? So if you ever get your hemoglobin A1C level checked, what you want to do is make sure that you're fasting at least for 6 to 8 hours prior to the exam being done. The reason why you want to fast, we can't get notifications are blocked. Why is notifications blocked? I have no idea why it's doing that. But are you saying that my notifications are blocked, meaning that if you want to get the notifications of my lives, you can't click the notification button? Is that what you said? On YouTube, on my YouTube channel, go and subscribe to the YouTube channel. Subscribe to the YouTube channel, and then we'll go from there. So I think that you have to be a subscriber first. If you subscribe to the YouTube channel, then you will be able to turn your notifications on, okay? And if that's not the case, then I don't mind going to my YouTube channel currently, and then I will make sure that I can update this right now. And I do want, once again, like I said, make sure that y'all are tuning in to today's morning radio show, High Level Shay Morning Show. That was a great one. Now let's get back into it. So you want to make sure you fast during your hemoglobin, because you don't want an inaccurate high level, okay? Now guaranteed, we're talking about the past 3 months, so it's reading exactly what you've done the past 3 months, but you want to just still fast because you don't want to tamper with the adequate lab results. No way possible, okay? So you want to make sure you fast 6 to 8 hours before your test, okay? 6 to 8 hours before your test. Any questions? And another thing I'll mention about blood sugar while you guys are typing your questions in, if you have it. Another thing I'll discuss is, really? It says, she said it's still blocked. I have to go in there and see. Let me see, because that shouldn't be happening. That really shouldn't be happening. I don't know why it's blocked and people can't subscribe. They were able to subscribe for a while. All right. So when we talking about your blood glucose, that was your A1C level. And again, as discussed, that's your past 3 months. Now we're talking about regular glucose checks, right? This is when you get the glucometer and then you prick your finger and then you actually put it on the test strip. The glucometer will read it and then it will tell you what is your current blood sugar level, right? So usually your blood sugar is between a normal one, I should say, between 70 and 120. Lower than 70 means you're hypoglycemic, meaning you don't have enough blood sugar in your body. You're gonna start having signs and symptoms of lethargic, meaning you're tired, confusion, because your brain is one organ that absolutely needs sugar in order to function properly, right? If you are hyperglycemic, greater than 120, then that means it's too much sugar in your body, and that means that your pancreas and your endocrine system isn't producing enough insulin to break down the sugar in your blood. All right, that's what that means. So you got the hemoglobin A1C, and then you have your regular glucose standard testing, right? So your regular A1C levels, yes, it's less than 5.5, Queen Yana. Less than 5.5. You want to be 5.5 or less when you go get your hemoglobin A1C level checked. When you are touching your full glucose, your regular blood sugar, you should be between 70 and 120. And this is even if like 2 hours after meals. All right. Now, we've already talked about it. So if y'all remember my last live, not the last lab, but in a previous lab, we did a whole lab on diabetes. On the endocrine system as a whole, diabetes type 2, diabetes type 1, diabetes type 3. Now, diabetes type 1 can be seen as an autoimmune disease because, you know, you can be pretty born with it. But what I will say is this. When we're talking about diabetes type 2 and 3, we went over foods to help lower your blood glucose. We went over causes and cures of diabetes type 2 and 3. We went over what exercise to do to lower the blood sugar. We went over a lot with diabetes, okay? I'm just here to tell y'all now about the lab values that I want y'all to make sure that you're able to interpret when we're talking about you being a patient advocate for yourself. Oops. So now I want to get into some other lab values. Do I have any questions on the one we're talking about? Because now I want to get into your ABGs, and I'm getting to ABGs. I thought that was important, which is your arterial blood gases. I thought that was important because we had a young lady on our lab who was saying how the doctor was saying that she may have asthma or sleep apnea, or they didn't know what was going on with her, when all along it was she had 20 pulmonary embolism. She had 20 blood clots in her lungs. And so I want to talk about the ABGs because you want to get your arterial blood gases checked when you are having shortness of breath, when you are having a hard time breathing, when you are having chest pains, because it's important for you to check your pH levels, meaning your blood's natural pH, because yes, your pH should be at a certain level. Too high or too low can indicate some abnormalities. You want to get your bicarbonate checked, your carbon dioxide level checked. You want to get all those levels checked. You want to get your oxygen level checks, your O2 sat levels checked. So we will be going over blood gases. We also going to be going over your normal vital signs. Normal vital signs, liver function, renal function, lipids, because we have a lot of people who have high cholesterol issues. So when I say lipid levels, we talk about your cholesterol issues. We're going to go over your coagulation labs. And those are the labs that determines whether your blood is coagulating, meaning clotting properly. Because you don't want it clotting too much and you're getting blood clots. But you don't want it not clotted and where you just always bleeding out and easily bruising, because that could be extremely dangerous as well. Any small bump, any small fall, you could be having internal bleeding. So you want to make sure those lab levels are normal as well. And then we're going to get into your CBCs. Thank y'all so much for the hearts. I love when I see the hearts. At least that lets me know that y'all are getting what I'm saying and you're understanding exactly what it is I'm trying to teach y'all. So thank y'all for the hearts. I do appreciate that. It motivates me to keep going, and it lets me know y'all are here. So thank y'all for the hearts, and do feel comfortable to make sure that you are commenting if you have anything. We already have quite a few people commenting, and I'm addressing them as so. If I am going too fast, or if I go over a subject that you would like for me to touch on and say, pause, what does that lab mean? Or what further questions should I ask for that lab? Like, ask me whatever. I don't mind stopping, okay? So let's get into the normal vital signs first. We're gonna start your heart rate, blood pressure, your respiratory, and your temperature. So temperature is pretty easy. Well, they are pretty easy, but I'll tell you. So we talk about the temperature. Your normal temperature should be 98.7. That is the normal human body's temperature in which it can function, okay? She said they need to keep tapping. Everyone needs this information. Our community education saves lives. Absolutely. Thank you. Thank you for those encouragements. And then somebody else says, yep, ABGs was fun. Metabolic alkalosis, acidosis, respiratory alkalosis, acidosis. That's right. That is absolutely right. She said the ABGs was fun. Now, I can't agree with you on that one. When I was in school, I couldn't stand doing the ABGs. I couldn't, but but they was absolutely important to know. And I had a bit of a, trust me, 15 years later in the field, I get it now. But as a novice with no medical background, and I was in school, talking about metabolic acidosis, respiratory acidosis, alkalosis, it was like, what is happening? But now I can interpret it and I do understand well. The same thing with EKGs. That was one of my things I just did not like, reading telemetry monitors and those scripts in school. But as a nurse, I absolutely understand it now. And I get it now, why it was so pertinent for us to know that information. All right. So if, let's say your temperature is low, that's and I know y'all have heard of hyperthermia, meaning a fever, and you've heard of hypothermia. All right, so let's break that down. What's happening to our body if we are lower than our known body temperature? Let's say we are 95. Let's say we somewhere stuck in a blizzard or on a mountain somewhere and an avalanche comes. I'll tell you right now, your body, first off, what's going to happen is when hypothermia is extremely dangerous, both of them are extremely dangerous, and I'm explaining to you why. If your body temperature and your is lower than normal, and I mean like 95, 94, first off, what you're doing is you're not getting an adequate amount of oxygen to your body and to your organs, especially your extended digits, like your fingers and your toes. So what your body's gonna do to save itself is it's gonna start pulling blood. It's gonna start pulling oxygen from the furthest part of your body first, and then goes into the middle, which is your heart, because it's trying to save your heart and your brain and your internal organs first. So you're gonna start to see darkness and blue discoloration and coldness in the hands and the feet and the fingers, that and on your ears. Once you start seeing like blue coloration or dark coloration of your ears, your lips, your fingertips, your toes, that is a danger sign. You need to get a warming blanket, a heating blanket in front of the oven. Don't get in the oven. In front of a stove. Touch body to body, get with another human being who's warmer than you, stranger or not, and save yourself. Because once those parts of your body become necrotic and they are without oxygen for an extensive amount of time, then they'll have to be either amputated or they'll just be no good. They'll fall off on their own over time. All right. And so when you are hypothermic, your body's going to want to save itself. So it is going to pull. And when I say pull, it is going to pull oxygen and warmth, like I said, from the first part of the body first to save your organs and to save its heart. So that's the first thing that's going to go, right? Then as you continue to be cold, your body's going to then shut down because now it's preserving energy. Like at first, say you're able to move. Let's say you somewhere where it's just freezing and there's a major blizzard and your car stopped working and you just can't, move anymore. So you just have to get out of your car and you just have to walk the rest of your way home. Your body's going to start shutting down. Your system is going to start shutting down because it's going to start preserving energy. Then as it's preserving energy, you're going to just start lying down. You won't be able to move anymore. You won't be able to walk anymore. And then eventually it's going to be a whole full system shutdown. And then you what is considered frozen to your demise, right? Now, that is me going from start all the way to extensive. But knowing your normal body temperature is a must, and knowing the signs and symptoms if you're becoming hypothermic is a must. Now let's talk about, thank you for the likes, I really appreciate it. Now let's talk about hyperthermia. So when you're hyperthermic, meaning your body temperature is elevated, it's greater than 98.7, and we're talking about 99s, 100s, that's considered a fever. So when you are having a fever, your body's natural response is to go into, to heat up first, because it's trying to heat up and destroy an infection, a virus, a bacteria, a foreign object. It's like, okay, again, it's going into defense mode. And so the first sign of sickness you're going to start seeing is a fever. That's your body's telling you that something inside of me isn't right. I don't like this, and I'm going to destroy you by any means necessary. I'm going to overheat myself to cook this strange virus, bacteria, bug, parasite, right? Now, what happens if your fever is going on for such an extensive amount of time, or if your fever is 103, 104, 105? Guess what's happening? At the same time your body is killing the disease, it's now killing your cells. All right? It's now pulling so much water intracellularly from your cells, because now you're becoming dehydrated, and that's when you start to have seizures. You're more prone to seizures. That is why when you have a baby, they say make sure your baby does not have a fever above 100, 101, because once a baby starts to get 102, that is considered extremely dangerous. Get your baby to the hospital. You want to get your baby to the hospital, because babies, their body is so small, it doesn't take long for their body to become dehydrated, their brain to become dehydrated, and for them to start having convulsive seizures. That is extremely dangerous, okay? I'm going to dial back for a second and say, when you're talking about hypothermia, if your body temperature, let's say you're not outside in the cold, stranded somewhere, you're at home, but you're hypothermic and you have what's called a low-grade fever. Let's say you're 95, 96. That can also indicate something called sepsis. Sepsis means that your body has an infection so bad, and all your systems are starting to shut your organ systems down. All right? It's starting to shut your organ systems down. All right? So you want to make sure you know your body temperature. You want to make sure that you know that lab. Next, we're going to talk about the respiratory issue. Normal respiration should be between 12 and 20. Respiration is meaning you're breathing per minute. So per minute, you should be breathing anytime between 12 and 20 breaths per minute. If you're breathing more than that, then that is considered hyperventilation. Okay? Hyperventilation, all right? And if so, you're hyperventilating, and what you're doing when you do that is you are, instead of you breathing out the carbon dioxide, you're consuming so much carbon dioxide inside of you, and you're not holding in enough oxygen. That can lead you into something called respiratory acidosis, okay? Respiratory acidosis. And that's when we're going to get into those ABGs, okay? That's why it's important that if you're hyperventilating, you're having anxiety attacks, you're short of breath, I can't catch my breath, what you want to do, I said that wrong. That means your body isn't holding in enough carbon dioxide. I said that wrong. So what, I want to correct myself, so sorry about that. What you want to do is you want to get a brown paper bag, and you want to put that over your mouth, so the carbon dioxide that you're breathing in, you want to make sure that you're able to put back in your body, because the brown paper bag is going to save it and allow it to go inside your body. And then you get yourself to the ER, or you have somebody take you to the ER, but you don't want to pass out and get lightheaded and while you're driving. So you call 911, or you have somebody take you to the ER, and don't forget the brown paper bag. All right? Let's say you are hypoventilating. Let's say that, and it's called like hypertachypnea and hypotachypnea. So hypotachypnea and you're hypoventilating, meaning it's less than 12, so you're not breathing in enough oxygen. Very slow breath. And that is is a bad sign as well. You should not be breathing too slow or too fast, okay? You should be between 12 to 20 breaths per minute. If you're breathing too slow, go to the emergency room. If you're breathing too fast, get your brown paper bag, call 911, all right? Do I have any questions so far? Blood. Yes, blood pressure. Let's talk about blood pressure. Now, the blood pressure is pretty tricky. And I gotta be honest with you, because not everybody is the same. Like, for example, athletes, genetically speaking, the more athletic you are, the lower your blood pressure is. Me, my normal blood pressure is like 90 over 60 or 90 over 59. Now, they say the normal blood pressure is 120 over 80, or, you know what I mean? So your systolic, the top number should be 120, and your bottom number should be 80. So 120 over 80 is considered normal. What I tell my patients is, what is your normal blood pressure? What is considered normal for you? Now, we don't want to be hypertensive. We don't want to have high blood pressure, because that's not normal. But when you say the normal is 120 over 80, but see, like for myself, mine is between like 90 and 60. They will be telling me that, you know, my blood pressure is too low, but I've been that way my entire life. I'm very athletic. And that's the question you want to make sure you tell them. If you are in the hospital or in the medical office and they're checking your blood pressure and your blood pressure is like 97 over 58, then their next question to you should be, how athletic are you? How active are you? Okay, that should be the next question. Now, if you're not active at all, and your blood pressure just low, you know, that way, the next thing you want to check is your heart rate. If your heart rate, and the normal heart rate is between 60 and 100, if your heart rate is elevated, then that is an indication of dehydration. All right. So I'll say it again. If you're active and your blood pressure is like 90s over 60s, then that's your norm. If you're not active and your heart rate is elevated, blood pressure is lower, then that is a sign of dehydration. And the next question you should be asking them is, can you check your BUN and your creatinine? That is your kidney function, okay? Somebody said mine is tachycardia. Now, tachycardia, what this person's talking about is heart rate being elevated. She's talking about her heart rate being above 100, all right? So I want to make sure we keep this in mind, all right? If you should get your blood pressure and your heart rate checked at least 1 hour after you sitting down, resting activity. Don't go to the doctor. Don't go do a marathon and go to the gym and then go get your blood pressure and your vitals checked, okay? Because your heartbeat is already going to be rapid because you was just doing a strenuous activity, such as running, excessive walking, bike riding, things of that nature, swimming. You should check your vitals when you are at rest for at least an hour at rest to get a more accurate reading, okay? And so this person is saying tachycardia, meaning her heart rate is always fast. Now, her heart rate is always fast. I'm going to ask her 2 questions, and I would like for you to answer this in the comments, Lolita. 1, how much water do you drink? I'll ask you that, like how much water. I'll also ask her about her weight. You know, and the reason I'm asking her about her weight is because 2 things. If she is what is considered overweight, then your heart is overworking itself, right? Your heart is pumping so much, and that could be an indication of, we'll talk about that later. That could be an indication of like a heart issue before you go to like congestive heart failure. If you are slender and you're a smaller build and your heart rate is fast and you properly hydrate, then the same thing with a baby. How a baby is small, it don't take your heart to pump blood throughout your system that much because you're already small. See, I'm a slender build woman. I'm 135 pounds. You see what I mean? So when my blood pressure is 90s over 60, heart rate of like 109, that's my norm. That's my norm. I don't have a lot of body for my blood to be trying to pump and circulate through. So it's gonna be able to circulate a lot faster from the middle into my extended body and then back to the middle into my extended body. So if she is a smaller frame woman, which she just actually said she's not overweight, her blood pressure is fine, so she's a smaller build woman, then these are the type of questions that I want y'all to ask y'all doctors so that y'all can and give them this information, because that will be her norm. All right, that'll be her norm. All right. Then we have your O2 sat. You want to check your O2 sat, and that is your oxygen saturation level, right? So your normal oxygen level should be between 95 and 100%. Your blood oxygen level should be between 95 and 100%. That means that the amount of oxygen that is circulating throughout your entire body from the red blood cells. All right. If your oxygen is between 95 and 90, then you will need oxygen, like an oxygen mask, nasal cannula, whatever it is, to help your oxygen levels, go back to an adequate level. All right. Low oxygen could cause you to be extremely weak, short of breath, have respiratory issues. Low oxygen could cause confusion. It can cause you to pass out and become unconscious. All right. If it is below 90, that is extremely dangerous. By that point, a lot of times you see it, the patient is completely lethargic, incoherent, not able to comprehend, don't even know that somebody's even in the room working on them. A lot of times they're not even awake. You still have a heart rate, you still alive, but at that point they need a non-rebreather mask so that they able to we're able to save them and bring them back to conscious and bring their their oxygen level back to normal. Now, here's when they're gonna do those ABGs on you. Somebody's gonna be in the room drawing the blood from your lab. And when we talk about the pH balance, normal body pH should be 7. And I want y'all to really look this up, and I want y'all to make sure that y'all writing this stuff down, because your normal pH should be between 7.35 and 7.45. Somebody in the comment earlier said respiratory acidosis, respiratory alkalosis. If your number is less than 7.35, then and it's a respiratory issue, then that is respiratory alkalosis. Okay? Respiratory alkalosis. All right? That's when you're going to be extremely short of breath. That's when you're going to be having those shallow breathing, and your respiration is less than 12. Then you have respiratory acidosis. That's the hyperventilation. Okay, those are the anxiety attacks. All right, and respiratory acidosis is when your blood level is above 7.45. So they're going to check these levels to see what is going on. Now, how do you know if you're respiratory or metabolic? What they're going to do is they're going to check your bicarbonate level. That's your HCO3. That's your bicarbonate level. Your bicarbonate level. So if your bicarbonate level, and I need y'all to write this down, if your bicarbonate level, HCO3, is normal, all right, and your carbon dioxide level is abnormal, and your pH is abnormal, that's how you'll be able to know if that's how you'll be able to know that is respiratory acidosis or alkalosis, depending on your pH. If your bicarb is abnormal, somebody said a question. All right. If your bicarb is abnormal, and your bicarb should be between 22 and 26. So your bicarb level should be between 22 and 26. So your bicarb level is below or above 22 and 26, then and your pH is off, then that's how you're going to be able to know if you're metabolic acidosis or alkalosis. And a lot of times you get that from diarrhea, from dehydration, from vomiting, nausea. Those are some things that affect your metabolic rate. And remember, we talked about those magnesium, the potassium, the sodium. We talked about that, right? So if you are having a lot of diarrhea, say you have a lot of diarrhea and you're vomiting, pregnant women, food poisoning, whatever. If you're having a lot of diarrhea, you're having some vomiting, I gotta go to the ER. I gotta go to the ER. Make sure they check your arterial blood gases, so you can know whether you're metabolic acidosis or metabolic alkalosis. You want to make sure that they also check your CMP, your complete metabolic panel. That's going to tell you about your potassium, your calcium, your magnesium, your sodium, your phosphorus, everything. Your red blood cells, your white blood cells. It's going to check everything. Okay? So this is how you be a patient advocate for yourself. Do I have any questions before I move on? Because now I'm going to get into, you know what? I don't think I went over potassium and sodium. I apologize. I think I just went over magnesium, calcium. I didn't go over your potassium and your sodium level. So let's go to potassium first. So potassium, your normal level of potassium should be between 3.5 and 5. The reason why potassium is extremely important is because potassium is one of the main minerals that you need, electrolytes that you need for your heart's function. If you have too much potassium, it will stop your heart. If you have too little potassium, it will stop your heart. All right? Sodium, your normal sodium level should be between 135 and 145. If you have too much sodium, then that is, we're talking about hypertension, we're talking about kidney disease, failure, we're talking about heart issues here. If your sodium level is too low, we're talking about still another heart issue. Because if the sodium level is too low, then that could indicate that you have too much fluid in your body. Too much fluid means that your heart and your kidneys isn't properly functioning to get rid of the fluids. So that can lead up. That can indicate signs of congestive heart failure. That can lead up to signs of kidney issues, chronic kidney disease, and now you on dialysis. You all swollen. You're full of fluid, so you're diluting that sodium. If you don't have the adequate amount of sodium, what happens to your brain? Your brain can't function properly. You begin to become so lethargic. You begin to become so confused. The same thing with the sugar. All right? Now, too much sodium. You having migraines. Your brain is pounding because it is so much sodium in your brain that the sodium is draining your cells, and it causes dehydration. It causes dehydration. She said, please tap. If y'all are learning anything, please tap the screen. If you guys are learning anything, I really like Back to the Basics. So thank you so much for tapping the screen and showing love. If you all are on this live and you are learning anything, I would appreciate it if y'all tap the screen and let me know that y'all are learning something from this live. Y'all are gaining something from this live. I greatly appreciate it. And thank you. I love you. I do. Thank you, thank you, thank you. Y'all gotta understand, it's easy for me to get up here and do this, but it's not easy, especially from a healthcare professional, because I think y'all can understand why. You know what I mean? You guys can figure out why it's not easy, but I enjoy getting up here telling you guys this information. I enjoy educating you guys on this information. I feel like everybody should know this information and how to be a great patient advocate for yourself. You don't have to go to school for this information. You don't have to have a degree for this information. Oh, she said, let's get it. I like that. She said, let's get this live to 10K. Like the live, let's get it to 10K. Let that be our goal. I like that goal. Let's get the live to 10K. Like the live, like the live. Double tap your screen. If you don't know how to like the live, double tap your screen. I appreciate that. Double tap, double tap. Monica, thank you for liking the live. Thank you for double tapping the screen. I appreciate that. Thank you. I appreciate you all. I really do. So what we're gonna do is we're gonna get into we talked about potassium and sodium. So those are important. Now let's get into your BUN. BUN creatinine. That is your liver. Those are your liver function panels. So we're talking about your liver here now, okay? So when you go and get your test done, you want to look at your BUN and your creatinine, okay? I'm going to tell y'all 2 different indications for these test results. Thank you, Elizabeth. You are so welcome. I appreciate it. This is I love doing this. Thank you for appreciating it. I appreciate when y'all appreciate it. It makes me want to, it encourages me to want to get on here and do it more. You see what I mean? Because I feel like I'm making a difference. Somebody's getting it. Somebody's understanding. And somebody's going to be a better patient advocate for themselves. When y'all go to the doctor's office and run y'all lab values and y'all see y'all potassium level a little off, then again, we're going to talk about potassium-rich foods, calcium-rich foods, magnesium-rich foods. We're going to discuss all these things. Foods that you can make sure, let's say potassium level is a little low, just slightly. Bananas. There are certain foods you can eat to make sure your potassium level is elevated. You don't have to go take a potassium tablet. You know what I mean? Just eat more potassium-rich foods. If your sodium level is low, eat more sodium-rich foods. If your magnesium level is low. Now, I'm not talking about critically low. well, you might need a magnesium infusion or a potassium tablet. I'm going to tell y'all about fruits, vegetables, and herbs that y'all can take to just help boost y'all levels up naturally. Let that be y'all primary care initially, and then we can go into secondary care, which is the modern day medicine way. All right. So we're gonna get into your BUN. So normal BUN is between 8 and 21. Normal BUN, bun, have you want to look at it, okay? All right. And that's your urea nitrogen, biliuria nitrogen, okay? That's your BUN. And this is the functions of your kidney. This is to tell you how your kidney is functioning, okay? What is improper or proper functioning. Then you get your creatinine. Your creatinine level is between 0.6 and 1.2. 0.6 and 1.2. I want to say this to y'all. I want y'all to listen to this part very clear. Tap, 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 tap the screen. I want y'all to continue tapping, but I want y'all to listen to what I'm about to ready to say. If your BUN level is elevated, but your creatinine level is normal, then that is a sign of dehydration. All right? Doesn't necessarily mean you have an acute kidney disease or acute kidney injury or a chronic kidney disease. That means you need to drink more water. You will be able to tell if you're dehydrated because your urine characteristics. Your urine will be darker. It'll have a foul ammonia odor. It more likely won't be clear, and you are at risk for a urinary tract infection, a UTI. So, if your BUN level is elevated, creatinine level is normal, then that is an indication of dehydration. Increase your water intake. Increase your water intake. Let's say your creatinine and your BUNs are elevated, then that is a sign that your kidney is not properly functioning. Why is it elevated? Why are those enzymes elevated? Those enzymes are elevated because it's saying there's a damage somewhere in your kidneys. It's your kidneys letting your body know that there is a damage somewhere. So if your levels are elevated in your blood, that's your body saying, hey, I'm damaged. Something isn't right. I'm hurting here. I need it to be fixed. If you start having like reoccurring UTIs, you start noticing that you are urinating a lot less than normal, no matter what you're putting in your body as fluids, it's not coming out the same. You know what I'm saying? So yes, that can lead to not only a UTI, but that can also lead to kidney stones. Okay, so you want to be careful when we're talking about the kidneys. All right, those labs. Now, let's say it's extremely elevated, like it's just extremely elevated. You're barely putting out any urine. Chronic back pain, and the reason you're having back pain, especially lower back pain, is because your kidneys are anatomically positioned towards your lower back. All right, so you're having all those chronic back pains, and it's radiating to the front, and your urine is dark, and you're barely putting out any urine, and you just having all this pain. And you need to go to the doctor immediately and get that assessed, or your herbalist, and start taking some like cilantro helps with opening up your nephrons and your kidneys. Taking some herbs that help with your kidneys. Greater burdock helps with opening up your kidneys and help with kidney filtration. Cilantro, I'm talking about, there's different fruits, vegetables, and herbs that help with opening up your kidneys, right? And making sure that you're properly functioning. What can damage your kidneys is, of course, we all know alcoholism could damage it. Drugs can damage it. Poor diet could damage the kidneys. But another thing that's really damaging to the kidneys is dehydration. Dehydration. That's why it's better to know and take care of yourself when you're young, because I can't begin to tell you how many people do not drink enough water. It's nasty. Well, then put a lemon in it. Put a strawberry in it. Put a blueberry in it. Do whatever you have to do. Eat your water. Drink your melons. Do whatever you have to do to make sure that you're properly hydrated. All right? Now, I'm saying this to say you don't want it to get extremely bad to the point where it becomes chronic kidney disease and kidney failure, and then you're on dialysis. You don't want to end up on dialysis. So what I'm teaching you is preventative measures on how you could just read these labs, take care of yourself. You see your BUN creatinine level, which is extremely elevated. Then I say, take the necessary steps. Be a patient advocate for yourself and say, okay, doc, those levels are elevated. I don't care if it's slightly elevated. They say, well, it's a little elevated, but that's no worries. There's always a worry. If it's outside of the normal range, and I'm saying that part, and I hope y'all put a pin in what I just said, because I see that a lot. I see that a lot with myself, first of all. And when I say for myself, because they don't know, a lot of times I go to the doctor, I don't tell them my profession. I don't do that. I withhold the information for a reason. And when I go and let's say my labs are slightly off, and I say, well, what is this off? They go, oh, that's just a little off. Don't worry about it. And then I have to explain to them who I am, and then I'm going to worry about it. I'm going to be a patient advocate. And they go, oh, well, you know what? Well, you know, at that point, I already know what to do, but I be just trying to see what they're going to say. So I'm speaking from experience from myself, and because I see it all the time often. If your labs are even just the slightest bit abnormal, do not let them tell you not to worry about it. Okay, I may not worry about it, but can you tell me what does this indicate? Can you tell me what can I do to make sure that it's within normal range, so the next time I get tested, it's within normal range? Don't let them just blow you off and say, just, you know, go home, don't worry about it, we'll test you next month. No, because I want next month when I come back for it to be in normal range. What is it that I can do? What is it that you recommend I do, so that when I come back in a month to get retested, it is within normal range? All right? That's how you be a patient advocate for yourself. And this goes for all the lab values I'm talking about on here. Every last one of them. I want you to tell them that if it's slightly elevated or not, or slightly low or not. All right? So that's your BUN and your creatinine levels. Now we're going to talk about your liver panel. Your liver panel, thank y'all for the hearts. Thank y'all for the likes. I'm going to slow down, take a deep breath and a sip of water myself. All right, do I have any questions so far first? Before I move on, do I have any questions? She said tap, guys. And then she told me my YouTube channel, she said that my subscription was locked. I have no idea how to unlock it. I had no idea it was locked. I don't even know how to fix it. But I will definitely work on it. Thank y'all for the likes. Thank y'all, thank y'all, thank you. I appreciate it. I appreciate it. Thank you all for the likes. Thank you all for the hearts. I want y'all to subscribe to my page. I don't know how to, I'm gonna fix this. Cause whatever I don't know how, please understand that I will figure it out. All right? And make sure y'all are subscribing to my page, okay? It'll be fixed by the end of today's working day, okay? She said I was able to subscribe, but can't get notifications. See, and whatever the issue is, that's why I love you. Whatever the issue is, we're going to get it fixed today. All right? And then I want you to watch that video, Higher Level Shay Morning Show that I posted today. And I'm telling you guys, I dropped some amazing gems about, I dropped some amazing gems about using your trust in your life insurance and how to borrow from your trust in your life insurance to get $50,000 to start your business. I also dropped gems on how to utilize government seized websites so that you can be able to purchase property very, very cheap. Because see, the money is in the land, not just the property. You want to make sure that you can seize land, and then you can do whatever you want to on your own land. You put whatever property you want on your own land. I also dropped gems later on in the live. We had Dr. Deborah Anderson, who was on there, and she was my special guest that I interviewed. So go to my YouTube channel and watch that, because if you're talking about business bonuses, you want to know about how to take your life insurance policy, how to use it for its, maximize its use and get $50,000 to invest in your own business, that's the lab you want to watch. All right? All right. Thank you. I appreciate that. I really do. So now we're going to get into the rest of these labs. I'll fix it. Don't even worry about it. I'll make sure that I figure out what's going on with this, and then we'll go from there. So I won't worry about it too much right now. All right. Now let's get back into the thank you. She said I'm learning. I appreciate it. Hey, back to the basics. Y'all thank her, because this is actually her idea, because I did my live on being a patient advocate, and she gave the great idea for me to go live about lab values. Lab values. If you're just now tuning in, I will be posting this live to my YouTube channel at Higher Levels with Shay. So this live will be on there. We talked about diabetes on previous lives, hypertension, cancer, cardiovascular issues, autoimmune disease, reproductive issues for both men and women, infertilities, how to tighten the vagina, how to strengthen the penis. We talked about how to deal with GI issues, your senses. We talked about kidney issues, dialysis, and we gave great herbs and remedies and medicine that you can use to help you alleviate those symptoms. We gave a great website so that you can purchase the herbs, and the website is great. They deliver fast, and they have herbs for cheap. No, herbs be like $50-$60. There's like $10-$15. So we got a lot on those labs. And so if y'all are interested in those labs, or if you have a question about like diabetes, about mental health issues, how to cure parasites, how to cure cancer, how to cure kidney issues, heart issues, liver issues, reproductive issues, PCOS, breast cancer, what else was it? Erectile dysfunction. I mean, we talked about a lot in my previous labs, and those labs are on my YouTube channel. All right. Now, when we talk about thank you for the hearts. Thank you all for the hearts, and thank y'all for liking the live. Thank y'all for following my page. I go live twice a week on my live, and at first I used to say like what days I'll go live, but then life happens, and then I have other engagements that I end up getting invited to, and so then I still do my lives, but it may be like a day earlier or some hours earlier, but guaranteed that I go live at least twice a week. At least twice a week I go live, and we talk about some form of a healthcare issue. All right. And I enjoy the questions that I get. I enjoy the DMs that I get. I enjoy everything. And if you want to be anonymous, I will keep you anonymous if you have a question. Actually, I had one person who, this is a great break to take. I'll talk about something. I had one person who actually DM'd me, and she asked me about her son. She said that her son had a rare skin issue and what I recommend to help cure his skin issues. And I gave her the regimens to help with his skin issues. I talked about like calendula and how calendula is a great herb to help with eczema, skin rashes, blisters, herpes. We talked about a lot when it came to her son with the skin issues. And then I also taught her about the body scrubs that I use, like a natural organic body scrub that I use, natural oils that I use, natural soaps that I use that'll help to cleanse your skin and brighten your skin and get a lot of dead cells off of your skin, and to help treat skin sunburns. So I appreciated her for reaching out to me and telling me that as well. I do want to, because I told y'all, if y'all want my last lab, we received a direct message from an anonymous, and she's gonna remain anonymous. And what happened is that with that lab is her husband, they went and got tested for an STI, and hers came back positive for gonorrhea. So hers came back positive for gonorrhea. He, on the other hand, refused to get tested. So in that time she was fighting him to get tested, he was being, apprehensive. He was being dismissive. He told her that the gonorrhea came from her having a yeast infection. And so she wrote in because she said that she Googled. She said she's not a fool, that she knows for a fact that it did not come from a yeast infection, but she was asking me for my opinion. And so we got some great responses in the comments. People were like giving her advice on what to do. Hey, cousin. And what happened with that one is this. So I gave her advice, and I was being very transparent with her, and I told her, wait, I gotta make sure, let me go back. She wrote me on Tuesday. I didn't respond Tuesday because I told her she told me to address it on my lab, but address it as anonymous. So I addressed it on Friday's lab. So after the live, she ended up DMing me back. So I want just y'all to follow me here. So I was addressing her on the live on Friday, and I told her that, gonorrhea comes from sexual intercourse, whether it's oral, vaginal, anal. It comes from sexual intercourse. You cannot catch gonorrhea from a yeast infection. That either she was being unfaithful or he was being unfaithful. Either way, somebody's sleeping with somebody and somebody's sleeping with them. All right. And so I told her that, and encouraged her to take her antibiotics, get herself together, and to reevaluate that marriage. Now, I would never tell anybody to leave their marriage. That's up to you. But at the same time, you have to be realistic with what's going on. When you come to me, I'm one of those friends who, I'm not a yes friend. I'm not a friend who's just going to tell you what you want to hear. I'm very, very honest. I'm very realistic, but I handle you with love and care. You're going to know it's come from a genuine place, okay? But also don't expect me to tell you what you want to hear either. And so I just couldn't sit on that laugh and not say anything. So I explained her how it came from her husband. If she's saying she's been faithful and he's refusing to get tested, and then absolutely it came from him. Whatever or whoever he's sleeping with, he contracted gonorrhea and he gave it to, he transmitted it to her. So I guess after that laugh, she ended up direct messaging me, and here's a follow-up. So she, with her consent, she said I can address on here, but she will still remain anonymous because I respect everyone's privacy. So she said that on Tuesday, she wrote the lab. She wrote me that question on Tuesday. He ended up going to get tested on Tuesday. So by the time I did the lab, his lab results came back. Now, you guys, and I want your honest opinion here too now. Be ready to type. I need your fingers on the keyboard board. Put it on the home row. His lab results came back negative. He had absolutely no STI at all. None. No gonorrhea, no chlamydia, no herpes, no HIV. He had nothing. So she did inform me she's never been unfaithful. She informed me that she's never, ever, ever, ever slept with anyone besides her husband. So she said that his came back negative. Oh, I see. That's why I love y'all. Monica said, what? Dominique said, I don't think she said it like that, but I'm just saying, what? Dominique said he already got cured. Lolita said he went and got meds. Back to the basics said toilet, so I think she just like flushing him away. I said, I love you guys. I love you guys. When I talk about, and I know you're on this laugh, and so I'm going to say this to you with love. He's a narcissist. Your husband is a narcissist at his best. And that is not conducive to your mental health or your physical health. What your husband did is exactly what the women in this comment is saying. The fact that he wouldn't go get tested when you told him to indicates to me that when you came home with your positive result, he already went and got tested. His test already came back positive, and then he went and got treated for that week. So you had already been getting treated, but behind your back, he himself was getting treated. Just so when he go and get tested, all right, man, you gonna just keep bugging me about this? I don't know these people. I'm just saying how I think how he was talking. All right, man, so you want to sin, keep saying, all right, man, forget it, I go and get tested. He went on ahead, he got tested, and then it came back negative. So that he can gaslight you and mess with your sanity and mess with your mental health and your common sense and say, you see, it had to been you. I'm negative. Sir. Look, Dominique said he probably knew way before, but was just waiting for the man to, hey, you know what? That's another one, Dominique. I didn't even think about that. He probably knew before her that he had the STD and had already been getting tested. But see, the only reason why I will think that he did it is because why would you wait 8 days to go get tested? You had already been getting cured. Like, I feel like she went and confronted him, and then he went and got tested. Because here's the scary thing about gonorrhea. Women will have signs and symptoms before a man does. Gonorrhea will literally lie dormant in the men a lot longer than women. Our pH balance is the one that's off. We're the one who is receiving bodily fluids inside of us more than men. And they're still receiving bodily fluids as well. That's why you get the sex transmitted disease. But they seem to... she said this seemed like a scene from Why Did I Get Married? Listen, if she saw the movie, and then somebody else says yes, somebody said facts, and my thing is this: we are handling you with love. These comments are coming from love. The women who are commenting, I thank y'all for y'all commentary. It is coming from love, but we have to be real with our anonymous sister here. And I think you know, she said, I'm not a fool, I know. And sometimes we just so clouded with love. When they say love is blind and it'll take over your mind, what you think is love is truly not. You need to elevate and find. That is the truth. And if anybody know what I'm talking about, you know what song I was just referring to. But love is blind, and it will, the narcissist, to me, I just feel like, and this is me being honest with you, the audacity of him to step out of your marriage, to step out of your covenant, bring you an STI, put your life at risk, and instead of him being apologetic and learning from his mistakes, he then goes and get himself treated behind your back, and then come to you and try to gaslight you to believe that you were the one who gave it to him. Listen, at the end of the day, everybody know I'm saved, sanctified, and I read my Bible holistically, so I believe in a union. But this is why it's important for you to marry a God-fearing man, somebody who knows who he are spiritually, because he's in a marriage and he's gonna gaslight you and say, well, you can't leave a marriage, we bind for life, we can't break this covenant. At the end of the day, this is what it means. You got to marry the right person. You know what I mean? Marry the person that God sent for you, not who you just wanted. Because he has zero regard for you, your health, and your respect. Because whoever he's sleeping with, he's not even using the condom. And I'm sure she knows about you. Somebody said this is the kind of stuff they do. They're very dishonest. Narcissism at its best. Being a narcissist and being with somebody who's extremely manipulative, it will make you lose your sanity. It'll make you lose yourself. It can lead to other health issues like mental health disease. It can lead to cardiovascular heart disease. It can lead to cancer. Thank you for the gift. Thank you, Rowan girl. Thank you. Yes, it can lead to cancer. How can stress lead to cancer? Because you have an abnormal cell growth. You're putting in those toxins, okay? And I need you to keep this in mind. STIs can lead to cancer. Gonorrhea, if untreated, let's say it lied dormant in you a little longer, and let's say you decided to ignore the signs and you just douching and just ignoring the foul odor or the discharge. Let's just say you was one of those people who you didn't want to go and face the facts that it wasn't a yeast infection, and so you're sitting there with this untreated disease. It can lead to something called human papillomavirus that leads to cancer, uterine cancer, that leads to ovarian cancer, that can spread and metastasize and lead to other cancers. So he has a disregard for you as a human, as his wife, your physical and your mental. And I myself, I can't see anybody who will be strong enough to stay. And I say strong, I don't mean that you're weak for leaving. Let's make that clear. I don't think somebody mentally can be strong enough to deal with the mental abuse. You're going to end up crashing. You're going to end up cracking under pressure. You're going to end up having a mental disease, whether it is anxiety, whether it's depression, whether it's schizophrenia, because now you're questioning your own sanity, and you know the truth, and you're going against your better judgment, your women intuition that God has provided us with. And so that's just some advice that I would like to give to you is love yourself more than you love that man. Honor yourself more than you honor that man. Value yourself way more than you value that man. Because he's not going to stop. If he hadn't apologized, if he hadn't admitted it, if he hadn't acknowledged his wrongdoings and he's putting off on you, do believe he's going to do it again. And the worst thing you could do is stick around and wait and you catch something that you can't get rid of. That you just cannot get rid of. So that is my advice. And it coming from love. And I do have tough love, but soft love. So I got to give it to you straight, but I'm going to give it to you with love. All right. So I just had to address that, you guys. Monica said, yes. Yeah, that's tough. That's tough. And she told me how long they've been married, and they've been married for some years, guys. They've been married for years, and he refuses to admit that he did it. So she don't even know who or where he got it from. So, or how long he's been cheating, how many times he's cheated. Has it been multiple women? Come to death row. What? You saying she gonna catch the stuff that she, is that what you saying? She gonna catch the Well, we're going to speak it into existence that God anoints her and open up her eyes, and God revealed to her how special she truly are, and revealed to her true purpose on this earth, and knowing that she's better than him. That's what we're going to do. We're going to pray for her healing. Exactly, Rowan girl. Great advice, praying for her healing. That's what we're going to pray for. We're going to pray for her to understand how truly special she truly is, and pray for her self-esteem, and pray for her realizing and recognizing who she was before she met this man. Get back in tune with yourself. Fall back in love with who you are. Go start journaling. Go start writing. Go start doing some art. Just go to the gym. Go start hanging out with your friends again. Not saying you are not, because I don't know you. But when you start just getting back to yourself, stop focusing on that man and start focusing on your spiritual journey. Get back connected. Get back closer to God. And listen to that voice in your head that's trying to save you. Okay? Because he does not care about you. Not the way he's moving. I don't see it. She said, great advice. Thank you all. Thank you all. Thank you all. All right. So I want to just address that. We took a little break. So thank you all for commenting who had something to say about the situation. You all clearly was on the same path I was on. And I think that she knows. But it does help to actually hear someone else say it. So just to confirm that you're not crazy. Like, I need to hear you tell me this man is using me because he asked me for my check every 2 weeks. Like, you know how you just need that confirmation? Like, I need you to tell me I'm being played. I need you to tell me I'm being used. And then I'm going to go and move on. So I think that's what our dear sister here needed. And I'm glad we was here. And nobody attacked her. You all was handling her with love. And that's what this platform is about. So I thank y'all for, just being real, but yet loving with her in this situation. So anonymous girl, you loved here, honey. Now go love yourself. All right. Yes, thank you. Oh, thank you. She said 10K, congrats. I love you guys. Thank you for the hearts. Thank y'all for the hearts. She said great advice. Thank you, thank you, thank you. Thank you. So if you just now tuning in, we took a little quick break to answer a DM from one of my followers. But what we were doing was going over lab values. Going over your lab values and how to be a patient advocate. So we went over a few electrolytes, went over the I'll tell you blood gas, we went over your vital signs, went over the kidney functions, chemistry test. Now we're gonna do the liver, coagulation, and the lipids, okay? And I'm gonna do the CBCs, the complete blood count as well. Your red blood cells, your white blood cells, and your platelets, and your hematocrit level, your hemoglobin level. I'm gonna do that one as well, okay? Thank you for supporting her, you guys. Yes, thank you for supporting her. They were very nice and kind. I appreciate that. Now, when we talk about and if y'all have any questions and you want to remain anonymous, you feel free to direct, DM me as well. I've been in the field 15 years. I have no problem with answering y'all questions on the live, and we getting this support. Y'all see on here is positive vibes. It's all love. Nobody attacked her. So you too are more than welcome to DM me as well. So we're talking about the liver function. Getting to liver function. So the liver function, you have your bilirubin, your AST levels, your ALT levels. These are your liver function tests, okay? So we're going to go over some in your albumin, right? Let's talk about albumin. So albumin and let's say the bilirubin for last, but your albumin level, that is a level that helps with your wound healing, damage. So let's say your albumin and your protein is it's a protein, right? It's an enzyme. So let's say your albumin level is low, really low. Then that is an indication that if you have an open wound or open scar, it's going to take a lot longer for it to heal because you don't have the proper protein in your body to help with the healing process, all right? It don't have to be an external wound. It can also be an internal wound, right? So the normal albumin level is 3.5 to 5. So 3.5 to 5 is your normal albumin level. So this is what I want to say about that. Let's say you do have a wound and you are not a diabetic, because we all know with diabetics, they tend to have they tend to be more prone to slow wound healing processes, okay? Now, let's go to you have a wound, and a surgical wound, because we also had somebody in here who said they had a BBL, and the BBL, there was some complications. She ended up getting the wound became necrotic. She was trying to heal it at home by herself, and then she gave, she asked me for, well, she didn't really ask me a question. I think she was just telling me that happened to her. She had to go in for another surgery. But let's say you go get a surgical procedure, and that wound is healing slowly, and you're doing everything the doctor told you to do for discharge instructions on how to properly heal the wound, take care of that wound, and it's healing extremely slow. And you want to go back and you want to get your lab work done again. Check your protein level. First, you're going to increase your protein doing wound healing, and you want to go back and check your albumin level. Why is this healing improperly? Low albumin, low AST, low ALT, low bilirubin, all those could indicate a liver issue. All right? Your liver issue. All right? And so if your albumin level is too high, then that too also indicates a liver issue. Why isn't your liver breaking this down? You see what I'm saying? Why isn't it breaking it down? So what is going on in your liver where your albumin level is either too low or too high? So you want to make sure you're checking these levels and understanding exactly what the normal lab value is. Your bilirubin. I don't know how many of y'all have children or not, but have you ever seen a baby who has that yellow in skin? They have yellow eyes, their palms are yellow, their skin like they're glowing, and they have to be under this like UV light. That is called jaundice. And jaundice is when it's too much bilirubin. So if your bilirubin is elevated, it's too much bilirubin in your blood. And normal bilirubin is between 0 and 1. 0 and 1. So if you have elevated bilirubin level, child or adult, but I say child because it's more prone you see jaundice in children. All right. And so that means that your liver is having a hard time breaking down the bilirubin, and so it's getting all into your bloodstream, and it's causing you to have this yellow glow, this yellow, high mustard yellow feces, and they end up putting the baby in an incubator, and they put them under this UV light because UV, and that's ultraviolet. Ultraviolet lights breaks down bilirubin. I'll say it again. Ultraviolet lights breaks down bilirubin. Where else can you get ultraviolet lights? The sun. Putting your child in the sun helps to break down bilirubin and helps to strengthen the liver. Putting your child in the sun also breaks down cholesterol and help it form into vitamin D. Putting your child in the sun also helps to increase serotonin and dopamine levels in your child. Putting your child in the sun helps with calcium absorption. Putting your child in the sun also helps with detoxifying your cells. The sun is an amazing place to be. All right? So, they put the baby under a UV light, and that UV light breaks down the bilirubin, and then the baby ends up pooping it out and until they go back to normal range, and then they don't have that color anymore. So those are some tests that you want to take so that you can make sure that your liver function panel is working properly. So your AST normal lab values is 12 to 37. 12 to 37. And y'all can look this up. So I don't expect y'all to be writing all this down. Look it up yourselves and just educate yourselves. The normal ALT level is 15 to 65. 15 to 65. And with those lab values, be mindful. And if any of those are out of range, ask them what is wrong with my liver. If it's slightly low or slightly high, ask them what preventative measures you can take so that you can have a proper functioning liver. If you drink alcohol, if you smoke, if you are on drugs, then you already know the answer. Drink more fluids. Drink more red blood cell producing foods like your beets, like your cherries. Cleanse and detox your blood with bloodroot, red clovers. These are herbs that we talked about on my last live when I gave y'all the website. So you can take care of yourself. All right? So I hope y'all have the site down. Now we're going to talk about coagulation. What is coagulation and why does that matter? Well, let's talk about it. When we talk about coagulation in your body, your coagulation, that's your platelets. You see what I'm saying? That's your platelet levels, your prothrombin time, which means it's your coagulation time, and then you do a PTT, and you do a fibrin test. Okay, so those are important because it tells your doctor and yourself exactly how your body's blood is coagulating, how it is functioning. Now, because I want to tell you, if it's low, if your PT-INR level is low and your PTT level is low, then that means that you are at great risk for blood clots. All right? You are at great risk for blood clots. That means that your blood is too thick. It is too thick. Your blood should always be able to coagulate, and the reason why you want to coagulate is, let's just say you don't have enough vitamin K, right? And you start having nosebleeds. Now, vitamin K is your green leafy vegetables, and vitamin K is a clotting factor, so it helps your blood to clot. So let's say you're not eating a lot of green leafy vegetables. You eat McDonald's, you eating Burger King, you eat McDonald's, you eating Burger King, you eating fried chicken over here, you eating pizza, you eating McDonald's, you eating Burger King. You're not putting any real phytonutrients in your body. But then you out there in the sun, and the blood thins when you're drinking alcohol. The blood thins when you're in the sun. And let's say you don't have your clotting factor isn't elevated. Isn't within normal range, but it's lower. And you start constantly having nosebleeds. You steady bumping into things, and you're easily bruised. If you're easily bruised, if you are, nope, I'm saying that backwards. I'm sorry, take that back. I'm saying that back. That's when your platelet count is too high. So I'm saying that back. Let's go back. So let's say that back. Let's say it's too low, and you you are eating green leafy vegetables. You're putting yourself at a greater risk of more blood clots. Let's say you travel a lot. You on a plane a lot. Let's say you sitting down a lot and you're not being active a lot, and you are always in a sitting position, or you standing for an extensive amount of time. You are at greater risk of blood clots already as it is. So if your levels are low, then that is just extremely dangerous. Oh, that's what I was saying. That's why I was on the right track. I wasn't on the wrong track. I was telling you why coagulation was important. That's what I was saying. So, thank you. That's what I was saying. So let's say that you in the sun and you start having nosebleeds, and your blood isn't coagulating enough. Then that's when you're more prone to easy bruising. That's when you're more prone to easy bleeding. Your heavier periods for women. For men, let's say something happens to you on a job and you have a cut, or you have you get injured, then what end up happening is you're gonna continue to bleed out profusely. So your blood is supposed to be able to clot to stop those injuries. It's a self-healing mechanism. You see what I'm saying? So that's what I was trying to get to. That's why it's important for your clotting factors to be within normal range. Now, let's say it's lower than normal. Now, it's going to be, if it's lower than normal, then that means that you're at a greater risk of blood clots. If it's at a higher number and it's higher than normal, then you are at risk for excessive bleeding and bruising. And that is not normal for you to bump your elbow into a wall or into a chair or into a doorknob and your elbow or your arm automatically bruised. That's not normal. What is going to happen to you if you accidentally fall down the stairs and you hit something internally and now you're bleeding internally? This is why it's important for you to check your lab values. You want to check your PT-INR. PT should be between 10 and 15 seconds. 10 and 15 seconds. All right? If your lab values are out of range, either up or down, then you should be asking them, yes, she says alpha thalassemia can cause clotting to trace slightly. Yes, it does. And that's a blood disorder. That's an autoimmune disease. That's a blood disorder. Don't actually get talked about enough. But that is a blood disorder. And she said that it causes clotting, and it does. And so when you are aware of these lab values and you understand the lab values, then you know how to be a better patient advocate for yourself. If your PT and your INR or your PTT, which your PTT should be between 25 and 56 seconds. 25 and 56 seconds is what your PTT should be, which means that's your clotting time. How long does it take your body to clot? All right? So if it's taking a long time and so your seconds are longer, then that is a dangerous place to be. That means you're easily bruised, you're easily to bleed. And if you're having those issues, then let's say it's slightly elevated. Your doctor should be telling you to increase your clotting foods, your vitamin K's, your spinach, your green leafy vegetables, your broccolis. They should be telling you that. If it is low, then that means that your it's clotting too fast. is clotting too fast. And you want to make sure you stay away from those green leafy vegetables. And you want to make sure that you stay away from like foods that'll help clot your blood even more, like high cholesterol foods, fried foods. You make sure you stay away from stuff like that. So that is what I want you to do when you are looking at your blood coagulation level, okay? Yep, vitamin K is a clotting factor. Vitamin K clots your blood, all right? So again, like I told one of my dear friends, she was talking about her heavy periods, and we went over menorrhea, and menorrhea meaning like difficulties with your menstrual cycle. We went over different herbs you could take to help regulate her menstruals and help regulate that. But one of the things that I told her to do, what I learned even as when I was younger, was if you eat green leafy vegetables, have y'all ever craved like spinach or greens or cabbage, broccoli during your menstrual cycle? That is your body telling you that it needs that vitamin K. So if you ever crave that food, even like when you're pregnant and you craving those greens, yes, she said me. Yeah, that's your body telling you. Fun fact, do y'all know that it is now being a test being done where, and this is going on about 7 years now. So 7 years now, this test has been done, been going on, and they are now making they're making the understanding and the coordination between your cravings when you're pregnant, like the foods you're craving, and the mineral deficiency or that your body is lacking. So let's say oh my goodness, I just gotta eat bananas. I just have to eat banana. All I'm craving is banana pudding, banana bread, banana this, banana. Doctors are now running tests on women who, they are part of the test, and and they are running tests to see what is her potassium level when she's craving the bananas. And they are finding out that what you crave during your pregnancy is your body actually saving itself. If you craving cereal, your body wants the calcium. You're craving dairy, your body wants the calcium. You know what I'm saying? You're craving greens and spinach, your body wants the vitamin K. You see what I'm saying? You're craving apples, your body wants the vitamin A. You know what I'm saying? So it is like amazing, and I'm extremely excited about this study because I have been saying that for years. Like what you crave during your pregnancy obviously means your body. It's what your body is needing. It's not what the baby is needing. It's what your body is needing as a whole to feed two people and to nourish two people during that process. So that was just a little fun fact I want to just throw out there. She said, "OMG, I was craving that like crazy." I'm telling you, your potassium level must have been low, and your body was replenishing itself. How many serves of green leaf vegetables if you don't clot at the proper time? I wouldn't say overdo it because then you don't want to overclot. But let's say if you are having let's say if you having like nosebleeds. Like for me back in the day, I used to always get nosebleeds in the summer, and I always went to spinach. Even when I was like 12, 10 years old, I always like, I need more spinach. Never did I understand why. It wasn't until I got in high school and went to the medical assistant program during my high school, and that's when I realized that spinach was full and rich with vitamin K. So my body every time my nose would bleed in the summer, I always ate the spinach out of, my mom's pantry because she had canned spinach or she had fresh spinach. Whatever one, I just ran to the spinach. Never understood why. Now keep in mind, I put a little salt, a little butter, a little cheese. I love to dress it up. But I always went to the spinach. And then once I got into the medical field where I was like, that's why I always crave that. You see what I mean? And so you don't want to overdo it. And so I said to say, let's say you easily bruising, or you are having a heavy period, or you are having bloody nose. Then consume the vitamin K as much as your body will tell you, because you'll get tired of it. You will no longer crave it. You won't want it anymore. I personally wouldn't say no more than 2 servings a week because you don't want to clot. But your body is going to tell you. If your body telling you to crave spinach every single day for 4 days in a row, then you eat it because you still need it. But then you're going to come to a time you're going to get tired of it. What if you craving ice cream? Maybe it's the dairy in the ice cream. Maybe it's the sugar in the ice cream. Maybe you hypoglycemic and you got low sugar and your body's craving the ice cream. It could be the calcium and the dairy, the vitamin D that's in the ice cream. So that's a little fun fact. All right. So let's get into lipids. Ice? No. See, And this is the thing about when people who crave ice. Ice is... Okay, so there are certain cravings during pregnancy that are actually abnormal cravings. And I can't believe it. I can't even begin to tell you how many people love eating ice during their pregnancies. And those people are either always anemic, and what it does is, and they have like a calcium deficiency, and it eats at the enamel in your teeth. So too much ice in pregnancy is going to eat at the enamel in your teeth, and then you're more prone to gum disease. So I wouldn't recommend anybody to just like overconsume ice during their pregnancies. Yeah, some women eat clay, some women eat dirt, some people eat the stuffing out of their what is it called? Out of their pillows. Some women have, abnormal cravings during pregnancy, So I wouldn't recommend anybody eating ice. You know what I mean? I wouldn't recommend anybody just eating ice during their pregnancy. Now, if you crave it, you want a little bit of it, then that's fine. But I wouldn't just recommend you just go out there and just be eating it every single day in a big cup, because that's very dangerous. All right, so we're gonna get to your cholesterol, and then lastly is the complete blood count. Now I want to talk about cholesterol here briefly. That's low density levels and your high density level, your lipids. So we're talking about the amount of fat that is in your body. Now, if y'all remember when we did the bone issue, we talked about osteoporosis, we talked about bone marrow, we talked about scoliosis, we talked about a lot of different bone issues in one of our labs. And in that lab, we talked about the yellow marrow, and we discussed how the yellow marrow in the bone helps to house fat and preserve it, so when your body needs it, it can release it and convert it into energy, right? But there is a such thing as too much fat in the bone, in the blood, in your arteries and in your veins. There is such thing as too much fat. And on top of that, be mindful, fun fact, that if you have a fracture of any kind, you want to dial back your calcium and you want to dial back your fat intake, because when you have a break in the bone, then that calcium in the bone marrow and that fat in the bone marrow is being released in the body, and so your blood calcium level going to be elevated, and your lipid level is going to be elevated due to that fracture. So another fun fact, if you have a fracture and you go get tested, they should be checking your blood work level, and if you have elevated calcium or elevated lipid level, then you need to slow down. And I'm saying that because if you continue taking calcium and lipids while you are healing from a fracture, which we all know fracture will take like up to 6 months to a year to heal, depending on the severity of it, you can develop kidney stones from the calcium because there's too much calcium in your body. And you can develop a cardiac issue because too much fat in the body. All right? Just a little fun fact that I want to just throw out there. All right? So your normal lipid levels, when you talk your cholesterol level should be less than 200. Again, your cholesterol level should be less than 200. All right? If it's greater than that, and you got to look at your LDLs and your high density level, that's considered your normal fat. It's your low density level you should be looking at, that you should be concerned about. So your low density means it's really thick fat, hard to break down fat. That is that fat that you get from fried foods, fast food, chips, all the toxic bad stuff, steaks, all that greasy fat that's around a steak. I'll tell you one thing. There's a physician who, he cracks me up. He have cholesterol lowering medication, and every time he go and get him a porterhouse steak, he takes 2 of those pills to balance it out. Like, physicians are hilarious, but he takes 2 of those pills. Like, I don't have cholesterol, and so he takes the lipid lowering medication while he's eating his porterhouse steak just to balance it out. I don't recommend anybody to do that, but what I'm saying is just be mindful of what's going on. She said, had parathyroid surgery. I was producing too much calcium. Yes, you were. Yeah. Yep. So she had a surgery on her parathyroid gland, and she said she was producing way too much calcium. And I wonder, were you did you have any kidney stones? So I would love to know the answer to that question. Now your LDL, your low density, that bad fat should be less than 150. All right, less than 150. All right. So now I'm going to go into your WBC. That's your white blood cell count. And this is important for y'all to know because your white blood cells, that is your immune system. You have your basophils, your eosinophils, your monophils. I want y'all to look up the white blood cells, okay? No kidney stones, but affect the kidneys a little. Yeah, so good you didn't develop kidney stones, but it definitely will because and what happens is because your kidneys is supposed to be able to break down and filter the calcium, and if it's too much calcium in your kidneys and it's absorbing all that calcium, then you will start to have kidney malfunction. So thank goodness that you caught it before you develop any kidney stones. So thank goodness. Now your white blood cells, I want y'all to look up the specific white blood cells, like basophils, your eosinophils. Look those up, okay? Your phagocytes, and understand the importance of each one of your white blood cells, right? Now, as the white blood cell as a whole, it should be between 5,000 to 11,000. That is normal white blood cell count. 5,000 to 1,000. I mean to 11,000. Oh Lord, I said 1,000. And when you have an elevated white blood cell count, that means you have an infection. Now, the reason why I'm saying look at your basophils, your basophils, your eosinophils is because those specific white blood cells will tell you exactly what's going on. They'll tell you whether it's a virus. They'll tell you whether it's a bacteria. They'll tell you what is going on in the body. What is it that it's trying to attack, and what is it trying to kill. But when your white blood cell count is elevated, note that means there's an infection somewhere. Fun fact: if you have an infection, your blood sugar level is going to be automatically elevated, whether you are diabetic or not. Why is that? Because your body is going to consume and absorb more sugar, because they're going to convert that sugar into energy so that your body can continue to fight off the infection. Your blood sugar is going to be elevated during the infection because your body is going to utilize it to convert it into energy so that it can fight off an infection. Fun fact. Now, let's say your white blood cell count is low. Well, if it's low, why is that a problem? All right, let's talk about it. If your white blood cell count is low, is less than 5,600, 5,000, if it's less than that, then you are more prone to infection because now you have a immune system that is now compromised. All right? Now your immune system is compromised, okay? And they call that leukocytopenia. Leukocytopenia, okay? So if you are leukocytopenic and your white blood cell, your immune system is compromised, then you are more prone to catching infections. Too high means you already got an infection, something is bad. Too low means you have an autoimmune disease and you have a compromised immune system. People like that, you typically don't see them with fresh flowers and, in the garden because they are at high risk for catching an infection, and your immune system isn't strong to fight that infection. So that is, you are more prone to really being in the hospital and really being sick when you catch a certain infection, bacteria, virus, or however, whatever germ, the smallest germ. You know how many people who have autoimmune diseases or they have a low immune system count, we do reverse precautions, right? So if you have something, let's say you have an infection, like TB or the C word or whatever in the hospital, or you have like C. diff, we will use the necessary precautions and the necessary personal protective equipment to protect ourselves from getting whatever it is you got. But when we're taking care of a patient that has low white blood cell counts, and you can be perfectly fine, we will still have to wear PPE, personal protective equipment, to protect you. Now, we don't want to get you sick. You know what I mean? Oh, thank you. You know what? That's crazy you said that. So Lolita said you need to get a nurse practitioner license. I love this. I was actually accepted into a very prominent doctorate program for my psychiatric nurse practitioners. I was gonna get my doctorate degree in psychiatric nurse practitioner, but that would have been another like 4 years in school. And I've been in school since I was in kindergarten. I have 3 degrees and a certification in herbalism. That would have been another 4 years in school. Now that is still on the table. However, I wanted to dial back and I wanted to do something else, you know, on my mission, and that is to sit here and educate you all and do what I'm doing. I do a lot of guest speaking. I do a lot of speaking engagements. I tour around the states, and I do a lot of women's conventions where we talk, where we encourage women, we uplift women, and we give great business advice. And because I run a few businesses, you see what I mean? So I just decided to take another route. I feel like, and I'm going to be completely honest with you, I feel like if I get to educate the masses on how to take care of themselves first, holistically, then we can get ahead of the game with you all constantly ending up in the hospital with a disease. See, if you already know what to do and know how to take care of yourself first, I felt like tackling the problem at the head first. And you tackle the problem at the head first by acknowledging about education and acknowledging what the real issue is. The real issue is not a lot of people are educated, not a lot of people are aware of these type of, you know, herbs and natural remedies and these labs and the disease process and how they get them. They're not educated on that. But once you educate them on that and you teach them, then they're able to make a well-informed decision on how to maneuver through their life. Now, people gonna still do what they want to do, but at least you're gonna know. You see what I mean? So I honestly was like, I could sit here for 4 years and go to school, or I can do what I'm doing now and do what I'm doing outside of these labs, when I'm actually in the field and I'm actually on the road and doing a lot of educating and doing a lot of lab events and stuff like that, where I'm educating the masses and truly making a real difference. I got the rest of my life to go back to school. I'm tired of sitting in somebody's classroom, and then you just a nurse practitioner, and you passing medicine, and you still taking care of sick people. How about just educate them so they won't be sick people? You know? So, thank you for that though. I appreciate it. Just wanted to just share that fun fact. All right. So then you got your, she said, I thank you and God bless you. Thank you. Thank you. That is so true. He said that is so true. Thank y'all for the hearts. I appreciate that. Thank you. Thank you, Monica. Thank you for that too. Thank y'all. I really appreciate that. I appreciate the support. I appreciate y'all for understanding the reason why I took this route instead. I go to school in 5 years from now. Until then, I'm going to continue doing this first. All right. So we're going to get into the red blood cells, and that's pretty simple. The number of red blood cells is between 4.5 and 5. You want to make sure those levels are normal. So just make sure that your body is receiving the adequate amount of blood that it needs to make sure that it is sustaining and maintaining all of your beautiful organs. Your skin, your hair, your skin, your digestive tract, your kidneys, your livers, your lungs, your heart, your brain, your toe, like everything. So that's just pretty normal. Too little blood. If you don't have enough blood, of course you're bleeding out is called hypovolemia, and that's when and a lot of times you see hypovolemia from people who, like gunshot wound victims, trauma victims, people who've lost a lot of blood, falling off a ladder, things of that nature. You'll see like loss of a lot of blood. So surgery, birth, giving birth, being in labor. So normally you will see people become hypovolemic for stuff like that, And so what they'll do to treat that is they will give you like a blood transfusion, give you some IV fluids to help bring your blood volume back to normal level. But kind of preventative measures, not from like surgery or anything like that, but just in general, how to keep a great blood volume is, of course, hydration and eating your fruits, vegetables, and herbs to help to boost up your blood cells and strengthen your red blood cells production, and which is like your liver and things of that nature. And so you're going to do some liver herbs to help strengthen the liver. You're going to do herbs that helps to cleanse and detox the blood, and you're going to eat your fruits and your vegetables that helps with helping with your red blood cell production. And again, like I said, we're going to talk about those fruits. That's going to be last. And then I think the last thing we're going to talk about is your hemoglobin. Now, the reason why your hemoglobin is important, that's a part of your red blood cells, right? Your hemoglobin is what binds the oxygen to the red blood cells, and then that way your entire body is receiving oxygen throughout the body. Remember, we already talked about your normal O2 sats. Your normal O2 sats should be between 95 and 100%, right? So when we talk about the hemoglobin, which iron helps to bind the hemoglobin to the blood, that's why your iron is important. we talk about the hemoglobin. You don't want to have a low hemoglobin because a low hemoglobin means low oxygen. All right? Your normal hemoglobin should be between 13 and 18. 13 and 18. So if you start having like shortness of breath, when you stand up, you are easily lightheaded and you're dizzy, go get your complete basic blood count. I said not basic, complete blood count checked. Go get your complete blood count checked. If you are, as soon as you stand up, you're so dizzy, you lightheaded, you feel like, whoa, get your blood pressure checked, get your vital check, and go get your blood count checked. Check your hemoglobin, check your iron, check your oxygen level. What words of encouragement I would give to everybody on this live is be sure to have vital machines in your house. Have a O2 saturation machine, like a pulse ox monitor that goes on your finger. Have that helps to read your heart rate, and it also helps to read the oxygen level that's in your blood. Go get a blood pressure cuff. It could be one on your hand, it could be one on your arm. Go get a stethoscope to listen to your heart. Go get a thermometer. I encourage everybody to do these things. These are basic things you should have in your house. If you have a can opener and a microwave, you should have vital machines in your house, because at the heat of the moment, anything can happen, and at least you can check your blood, your vital signs before 911 gets to you, and you can say, this is what's going on with me, okay? Now, that is all I have when it comes to the labs. I hope y'all learned a lot. Tap the screen if y'all learned anything. And we're going to go over some foods really quickly to help you all. So that is all I have for labs. And I want to go over some foods that we could discuss here. She said, yes, great, awesome. Yes, we do. Did we do? You know what? Did we do that already? I'm trying to think. Because I believe that one is actually one we going over on Saturday. So make sure that you follow my page. We're doing thyroids. I don't think we did goiter. We did not. We didn't do thyroid issues. We're going to go over the the endocrine system as a whole, where we talk about hypothyroidism, hyperthyroidism. We're going to talk about Addison's degree. We're going to talk about Graves' disease. We're going to talk about a goiter. We're going to talk about all of that on Saturday. So, Saturday. I said it right. So on Saturday, we're going to talk about everything. And we're going to talk about different herbs, different remedies, the causes, and everything. So make sure y'all are sharing and following my live and following my page. And I will be posting this on my YouTube channel at Higher Levels with Shay. All right. So some protein-rich foods. Protein-rich foods or amino acid foods. We all know meat, but I'm not saying meat because the meat today ain't real meat. So we got tofu. We have walnuts. We have salmon. Yogurt. Hey, Soshi. We have haddock. Peanuts and peanut butter. Peanuts and peanut butter. Those are really, really, really high. And when I say yogurt, Greek yogurt. So we did a lot today. We talked about different labs, went over lab values. The other day we went over how to be a patient advocate. I did a full Q&A session where we would just kind of open up the floor to people just come in and chime in and ask me questions. And we had some great questions on that live. And then one of our amazing commentators who's on here now, she advised me to go over lab values. So we went over a lot of labs today. Just your general labs first, your CBCs, your CMPs, red blood cells, white blood cells, your arterial blood gases, your we went over your glucose levels, liver levels, kidney levels, and we went over your electrolyte levels and what they all entail. She said, oh, cool, just getting back in town. Great to have you back. Safe travels. Glad you had a safe trip. And on Saturday, we're going to be discussing the endocrine system, thyroid issues, hypo and hyper, Addison's and Cushing's syndrome, and goiters. We're going to be going over all those, and we're going to be talking about different cures and different herbs to relieve yourself of those signs and symptoms, okay? So those are some foods that are high in protein. Now I want to get some foods that are high in magnesium. Foods that are high in magnesium. Am I going too fast, or y'all are following me? And thank y'all for the hearts. Thank y'all for the shares. I do appreciate it. All right, so we have some foods that are high in magnesium. We have dark chocolate, avocado, squash, acorn squash, butternut squash. I like squash. Bananas, lima beans, rice, potatoes, and whole wheat bread. Those are just to name a few. Just to name a few. Do your own research. And find a high magnesium food that's best fits you. You can Google this stuff, okay? Potassium. Foods that are high in potassium. Bananas, whole wheat bread, grains. They're saying that grains is bad for you now. They're saying that whole wheat bread is bad for you now. I personally feel like this is why I make my own bread. That's one thing. I make my own bread. I got a bread maker. I make my own bread. But they claim that it's bad for you now. And I don't know if they're saying it's bad for you now because of the protein in it, or they saying that it's bad for you because I don't know. But I still eat whole wheat bread. I'm gonna be completely transparent with you. I don't eat white bread because of the starch, and I know what that does for you when it come out ADHD and autism and dementia. So I know the white bread is bad for you, and it has those little parasites in it that helps, that travels to your brain. But whole wheat bread, I still eat whole wheat bread, and I make my own bread. And it could be because of the gluten that's in it, but it's gluten in white bread too. So I told you I'll be completely transparent. I'll tell you what I do eat, and I'll tell you what I don't eat. But I will say this, everything is in moderation. Everything, you just can't stop eating everything at once and just do a whole holistic lifestyle change in one day. But I will say, like, stop eating your meats first, slow down with the meats first, then the dairy, and work your way out, work into a better lifestyle, a healthier lifestyle. And then eventually, you will figure out the foods that best fits you. Make your own bread. It's easy. Buy a bread maker and then get you some self-rising yeast and make your own bread. Make your own bread. But see, I don't know if it's because of the gluten, because it's gluten in everything. So why would whole wheat bread be bad for you but not a biscuit? You see what I mean? So, or rye bread, you know what I mean? It's gluten in everything. So I can't say it's because of the gluten, because then they should say don't eat dough, don't eat bread, period. Don't eat pizza crust. You see what I'm saying? Pizza crust has gluten in it as well. They have gluten-free of all these parts that I'm naming, but it has to be something different. Someone is promoting organic only. Your thoughts? Now, if you're talking about organic and it's you yourself doing it, like you yourself is growing your own organic foods, then absolutely. I personally do shop organic. So organic just simply means that there was no pesticides, but you could never be too sure unless you're growing your own. And remember, we talked about this, Rowan girl. We said that eventually one of the last is gonna be me going through with you all how to grow your own foods, how to cultivate your own land, and how to grow your own herbs and make your own tinctures and your own medicines. And so I do everything organic, and I have there's natural remedies to rid pests out of your garden. You know what I mean? Like lemongrass helps to repel mosquitoes and things of that nature. And so the lemon zest smell helps to repel certain bugs. So it's like we're gonna go over all those tips on how to naturally keep your garden safe without spraying harm chemicals on it. But Is it safe to buy the organic foods? Yes, it is safer to buy the organic foods. But can you be sure 100% that particular company did everything organically? No, because we weren't there. So that's why for me, I love to be self-sufficient. I do. I love growing my own. I have my peach tree, my apple tree, my plum trees, my pomegranate trees, my lemon tree, my lime tree, cherries, blueberry bushes. I just love doing it on my own. Not to say I don't never go to the grocery store because I don't have every single thing. And when I run short on certain fruits and vegetables, then I have to go to my local farmer's market or go to the organic aisle. So I do still shop, but nowhere near as much as I was 4 years ago. Nowhere near. You know? So I do want to eventually get on those labs with you all about that. So yeah, I will recommend organic, but I also recommend you start to looking into gardening and growing your own food. And that's gonna come in handy really soon. And next year or two, you're gonna be very, very thankful you started gardening and growing your own food. Because it's about to get serious. You know what I mean? And so when we talk about potassium, you want to make sure that you can have potatoes, whether it's sweet potatoes, Idaho potatoes, yams. You want to, those are high in potassium. Like I said, bananas are really high in potassium. Berries are high in potassium. You have your natto beans. Some of the beans are really high in potassium. Brussels sprouts and asparagus is really high in potassium. Now, of course, they have some meats that are high in potassium. But again, like I said, do your own homework on the meats and do your own homework on the meat company that is producing this meat, because a lot of the meats is being 3D printed and glued together and manufactured, and it's just not good. All right, so that's all I have for you all today, and I will see y'all back here Saturday, and thank y'all for tuning in. Do I have any questions before I leave here? Don't forget, Saturday we're going to be going over the thyroid glands and different remedies you could take for that. And today, if you missed today's morning radio show, I did my morning show. I got my radio show, Higher Level Shay Morning Show, on Mondays at 10 a.m. I go live on my YouTube, and I also go live on my Facebook, but it is on the KP TV and KP radio station. Well, we broadcast over 9 different streaming platforms and have over 70,000 listeners a month. So I did that show, and I want you all to go to my YouTube channel at Higher Level Shay and watch that show, because we talked about not grants. We talked about 5 different websites that you can log into to purchase government seized property for cheap. We also talked about your trust and how to take your life insurance policy, put it into your trust, and how to borrow from that to help fund your business and build generational wealth for your children and your grandchildren. We also had a special guest, Dr. Deborah Anderson. She was amazing, telling her upcoming event and her book and her school of ministry and how she uplift young women and open up doors for them. So if you didn't catch that show, make sure that you go tune in and follow my YouTube channel so that you can watch me live every Monday and tune in to that morning show. If you are a business owner and you have a product that you want to advertise on the show, or if you want to be a guest on the show, then you can email me at higherlevelswithshay@gmail.com. higherlevelswithshay@gmail.com. Thank y'all for tuning in. I love y'all, and I will see y'all Saturday. Have a great night. God bless you all. Bye.